everyone, it's Nicole Martinez. I'm over here at the Huhuka Memorial Hospital at the Seed Farm Pavilion. We're going to be talking with Dr. Savala, the director of the Women's Health Services, as well as her team. So let's go ahead and learn some more.
Hi everyone, I'm Dr. Savala. I'm the Director of Women's Health for Gila River. I've been with Gila River for 6 years, and I see patients out of our Sacatawan clinic.
Why is it important for women to get their regular mammograms done?
So unfortunately, breast cancer is the most common cancer diagnosis women receive. And our general lifetime risk of developing breast cancer is 12%. So that breaks down to about 1 in 8 women may be diagnosed with breast cancer. Breast cancer is the second leading cause of cancer-related death for Native American women. Because of that, screening mammograms are very important.
And can you explain how often women should get their mammograms checked, or how often they should be checked just for anything?
So screening mammograms are recommended yearly, starting at age 40. And that's just for routine, everyone with any risk factors. But something that increases your risk, it could be like family history or genetics. So for example, your mother, your grandmother, your sister, that may put you at an increased risk of breast cancer. I have a personal history. I have a strong family history of breast cancer. My mom and my grandmother both have breast cancer. And my mom, actually, because of my grandmother's history, made sure she got her mammogram every year. Pretty much a year to the date of her prior mammogram, she had screened positive for breast cancer. So it was very small. Usually that's why we do the mammograms. That's the whole point, because it's before we can feel anything. It's very small, but hers was pretty aggressive. So she actually did, she had to get surgery and chemo and radiation, and so she did those, and she's doing great. She's in remission. So it's been 9 years. But the thing with that is, I knew that she had been diagnosed on a screening mammogram, but I was just talking to her today, and she said my grandmother was diagnosed on a screening mammogram too. It was picked up. So that's good, and my grandmother actually had it twice, but the first time it was the screening mammogram, and it was picked up, and she lived a long time after that. So the whole point with screening mammograms is because we want to detect it early, and because we know if we detect it early, we're going to be able to, especially with the treatments we have available, there's a higher chance that they're going to survive that. It's going to increase their risk of survival by early detection and then treatment.
Okay, thank you so much for that. And then Dr. Savala, I do want to ask, what are different types of mammograms, and then what makes them different? So
for here at Gila River, we offer screening mammograms. So screening mammograms are just the no problem mammograms. You're just coming for your routine exams. I don't have any issues with my breasts. I don't have any pain. Those are the mammograms that we do here. So that one will take, several pictures of each breast. Screening mammogram is a screening, it's a limited exam, but if you have, say you come in with a pain or a lump, you're going to need something more detailed. Like a diagnostic mammogram has a little bit like different pictures that they do. And then on top of that, often we order an ultrasound, or we do the breast MRI. Sometimes we recommend biopsies. It just all depends on what we see. So you actually have the ability to schedule the mammogram yourself. That's called self-referral. So you would call medical imaging, and you would just say, hey, I want to get my screening mammogram done, and they'll get you scheduled, and you can get done on the mobile unit. The results will come to us at Women's Clinic. So to come to the women's health physicians, and we'll go over them. You may get a call from us to come in, and it might just be because we need to go over the information. We may require additional imaging. Don't stress, just come in so we can talk about that.
How long does it take to get a mammogram done?
Once you actually get it done, get scheduled, and you're in the unit to get the mammogram, I would say probably less than 10 minutes. It's pretty fast. They do the x-rays. They're very skilled. The mammogram techs do this every day, all day long. They're very respectful. They'll make sure that you're covered where you can be covered, and you are in and out of there usually less than 15 minutes. You should be done.
What other women's health services are offered other than the mammograms?
So when it comes to women's health, we see women of all ages. So I've seen patients as young as 10, but if there's ever an issue before, they can always come in sooner. And I see, our elders, there's no age limit on that. As I tell a lot of patients, it's all about education. So sometimes our patients will bring in their daughters just to kind of learn a little bit more about, their health, like what all the changes that their bodies are going through. I get a lot of patients that'll come in because their periods are irregular, and that's really common in young women and our younger patients, and that's okay. So it's really all about making sure they understand how their bodies function and what to kind of expect. We talk about issues with sexually transmitted infections, prevention, treatments. We do a lot regarding fertility concerns. Of course, we do pregnancy care. well woman exams, so those patients that come with really no issues just to get screened, we do that too. We recommend exams every year, and that's just for screening exams. But we also have patients, we see them for concerns as well. You know, we want to see you for both. So if you have any questions, any concerns, we want you to come in. You know, make an appointment, come see us, and we can talk about it.
Hi, my name is Camie. I am the Mammogram Coordinator for Gila River Healthcare.
When patients come in, what should they prepare for when getting a mammogram done?
On the day of their mammogram, they should not wear perfumes, powders, lotions, and deodorant. As far as clothing is concerned, come in something comfortable, but certainly you can wear whatever you would like.
Can you walk us through when a patient comes in and what they're going to be going through step by step?
Sure, I would love to. On the day of your exam, you'll check in with me in the lobby of the Seed Farm Pavilion at the mammogram table. And then after you've checked in, we walk you out to the mobile unit. On our way there, we'll go over things such as the length of your exam, your reports, how you'll receive them, the length of time it might take. We will then walk you into the mom unit where the tech aide will check you in. You'll fill out some paperwork, and then from there, the tech will take you to do your exam. We do have two options for entering the unit. There are stairs, but we also offer a lift for those who might need it. If that's something that you would like to use, we have you seated comfortably within the lobby, and then we'll take you out to use the lift to enter the unit.
What steps are taken through the screening process?
We are very discreet when we screen our patients. We like to go over those questions in a very private way and very slowly to make sure that they're understanding what questions are being asked, and they're comfortable with giving us the answers that are needed to make their exams as comfortable as they can be.
And then Camie, what are the days and the locations for the mammograms?
We do them from 8 to 4:45 here in Sagatona on Tuesdays, and then at Red Tail Hawk on Thursdays by appointment only.
What makes you so passionate about the job that you do?
I love being able to help these women here at Gila River. It's so important that we do our mammograms. One of the things that I love about the units that come to our location is that they're each named after a breast cancer survivor or in memory of someone that had their experience with breast cancer. For instance, we have one of our mobile units that's named after Vicki Lee, who unfortunately passed away from breast cancer. Her daughter is actually a tech for Simon Med Mom Unit, and she loves to share her story. Mammograms are so important for early detection and important for us and our families to ensure that we can catch it early and be able to receive the care that we need to overcome breast cancer.
Hey everyone, it's Nicole. I want to say a big thank you to Dr. Savala and Camie for all the information that they have given us. If you want to go ahead and make an appointment, please give us a call. The number is going to be at the end of the video. But until then, see you guys soon.